Hello all, my name is Meredith Cherry, and during this presentation, I will be discussing my honors thesis project titled Hallucinogenic and Sedative Drug Treatments and its Impact on Mental Health Nursing. During this presentation, I will discuss how psychiatric healthcare is a complex and radically changing discipline that must continuously adapt to evidence-based practices, including the use of alternative options for the treatment of mental illnesses. Throughout the history of society, mental illness has been stigmatized and in the past may not have been emphasized as an important issue to address when providing healthcare to individuals. Media sources have over dramatized the role of mental health nursing and have contributed to some of the stigmas in this area of nursing. These stereotypes of what are expected in a psychiatric unit or hospital are usually thought of as something out of a movie, such as One Flew Over the Cuckoo's Nest, Psycho, or negative images of these settings from TV shows and other media outlet influences, which are readily available to the general public. There is a lack of discussion about the stigmas that plague the profession of mental health nursing. It has been discussed that these stigmas have an effect on nursing student field choices. Studies have found that some students reported the idea of psychiatric nursing as being a backup option, or they have been warned by their family to not enter this area of nursing. Stigmatism in the field of psychiatric nursing is not only seen with the general public, but also among healthcare professionals. Research has discussed how some healthcare professionals assume nurses go into the psychiatric field because of their own psychological flaws or trauma from their childhood. These assumptions only fuel the stereotypes that flood this profession. One Flew Over the Cuckoo's Nest is a popular film that is a prime example of an over-dramatized depiction of psychiatric unit that sways the public's view of mental health. It is important to understand the differences between traditional nurses and psychiatric nurses. Traditional nursing roles are usually associated with working in medical surgical settings on a hospital floor. Traditional nurses' priorities lie in the physiological needs of their patients, not the psychological. This means that they work on treating or curing visible disease processes. In all parts of the hospital or medical setting, you are guaranteed to run into a mental health situation. Many patients have mental health needs. Thus, it is expected that all nurses will utilize psychiatric nursing skills during their career. As a psychiatric nurse, you still have the life of your patients in your hands. However, it is vastly different than making sure your patient survives a visible illness, such as hypertension or diabetes. The responsibility of the entire floor falls upon the nursing staff, as the patients are a danger to themselves or others, or are unable to care for themselves. Psychiatric nurses are also in a unique position to build rapport and trust with their patients, which can assist with creating opportunities to help these patients with considering various modes of treatment options during their time of need. The use of psychedelic drug treatment is not new to the medical field. In the past, clinical trials examined the use of hallucinogenic drugs for a variety of medical treatments. However, due to safety and ethical concerns, these trials were halted. With changes in clinical research trials, the use of hallucinogenic drugs has again become a viable treatment option, especially for individuals with mental illnesses. However, it is important to look back at the history of psychedelic drug use before exploring the current use of these alternative drug treatment options. In the past, the drug LSD was used in a few unorthodox clinical trials, most notably in the 1960s. Leary and Alpert conducted the Harvard psilocybin project, where they used psilocybin as a way to further understand the human psychology as it relates to the environment and how psychedelics affect the human brain. The project was shut down by Harvard, and both professors were banished from academia when it was discovered that their study did not follow the code of ethics. Lear and Alpert were said to have given the drug to undergraduate and graduate students without their consent, all while they themselves were using the hallucinogen. Dr. Sidney Cohen made waves in the 1960s, discussing the use of LSD as a treatment for alcoholism and as a method for enhancing creativity. Dr. Cohen conducted 3 different LSD clinical trials. In the 1960s, a project funded by NASA attempted to examine an unusual way to communicate with dolphins. Dr. John C. Lilly injected himself and a dolphin named Peter with LSD in search of a new way to communicate. As would be expected, when NASA got word of what was happening in the study, it was immediately shut down. Another notable psychedelic drug research trial was conducted in 1957 by a psychiatrist named Dr. Humphrey Osmond. Dr. Osmond researched LSD and believed this drug was showing promise as a possible treatment for mental illnesses. Osmond tested the use of LSD as a way to possibly understand schizophrenia. He then shifted to examining LSD as a therapeutic option for alcoholism, which showed promise but not long after these findings were discovered, support for this type of research was withdrawn. Shortly after the shutdown of these trials, it was evident that these drugs had flooded the black market, causing drug abuse. This led to the Controlled Substance Act of 1970, where President Nixon enacted government crackdown on the regulation of certain drugs, including psychedelic and sedative drugs. The use of hallucinogenic and sedative drugs has recently been re examined as an option for the treatment of mental illnesses. Since some of the common drug treatment options have been discovered as not being as effective as researchers once thought, for example, selective serotonin reuptake inhibitors, or SSRIs, which are the drug commonly used to treat depression, have only been found to be effective in 1 out of 5 people, and in addition may come with undesired side effects. Institutions such as Imperial, Johns Hopkins, Berkeley, University of California, the Icahn School of Medicine have all opened centers devoted to learning more about the treatment options of psychedelic drugs. Recently, ketamine, LSD, and other psychedelic drugs have demonstrated the potential to be a viable treatment option for a variety of mental health disorders. For instance, psychedelic drug treatment has shown to be one of the most effective treatments options for post-traumatic stress disorder, or PTSD. Psilocybin, otherwise known as the hallucinogenic ingredient in mushrooms, was recently legalized in 2020 by Oregon as a treatment option for PTSD, depression, and anxiety, and has shown promising effects for the future. Psilocybin has also been studied for end-of-life care and smoking cessation. End of life care is a sensitive topic and can be difficult for patients to talk about and for providers to treat. In a recent study conducted with terminally ill patients, psilocybin was shown to have a positive effect on the palliative care by reducing the anxiety associated with dying. Pilot research with using psilocybin for smoking cessation has shown greater success than conventional and pharmaceutical treatment options with minimal side effects. These research trials demonstrate the expansive capacity that psychedelic and sedative drug treatments may offer outside of psychiatry. The psilocybin trials have to be carefully carried out with sensation deprivation as depicted in the image shown. Ecstasy is an hallucinogenic drug that is also referred to as LSD, MDMA, and Molly, and has shown significant improvement in symptoms of post traumatic stress disorder. PTSD is a mental illness that can be difficult to treat and may not respond well to traditional psychiatric medications. And because of this, psychedelics are again being researched as a potential treatment option for this disorder. Ecstasy works by flooding the brain with serotonin, and in recent trials, results found that 67% of the participants no longer experienced symptoms of PTSD. These findings have led to increased studies and into the use of hallucinogenic and sedative drug treatments for mental illness. Ketamine, a sedative drug, has recently been approved by the U.S. Food and Drug Administration, or the FDA, as a prescription nasal spray called esketamine, which is indicated for the use in conjunction with an antidepressant for patients with treatment-resistant depression. Research on the use of esketamine has demonstrated a statistically significant reduction in depressive symptoms in as little as 2 days. Since this drug has had such a drastic positive effect on patients during clinical trials, the FDA designated esketamine as a fast track and breakthrough therapy, which is something the FDA has not done in decades. Typically, antidepressant drugs usually take 4 to 6 weeks to begin having any effect. Therefore, discoveries like what have been seen with esketamine could result in drastic changes to the way treatment-resistant depression is managed. In conclusion, psychiatric healthcare is evolving towards more innovative treatment options, including the recent resurgence of hallucinogenic and sedative drugs. Since newer psychedelic and sedative drug trials have been safely administered and have had reliable results, it is probable that soon there will be a drastic change in treatment options for mental health disorders. Psychiatric nurses have the potential to play a crucial role in the implementation of psychedelic and sedative drug treatment option in practice. As previously mentioned, psychiatric nurses are in a prime role to build therapeutic and trusting relationships with patients and are well aware of stigmas that may accompany alternative forms of treatment. There is a long and difficult path in front of psychedelic and sedative drug treatment movement due to many obstacles such as stigma that must be overcome. However, this has not deterred scientists from researching the use of these drugs in current and future practice. Many scientists feel confident that we are on the verge of a major breakthrough for how we treat mental illnesses with these alternative forms of drug treatment, which could lead to significantly improved patient outcomes. Thank you all for listening to my presentation, and I would love to answer any questions you all may have.